Welcome to Babies and Bones. Click to subscribe below.
Don't forget to like and comment. Your comments can guide us on what videos we make next. Hello, I'm Dr. Nima.
Hi, I'm Dr. Kate, and after my first pregnancy with my first daughter, Olivia, I started getting horrible pain at the base of my thumb and my wrist. And I asked my husband, Nima, what is going on? Why do I have such bad pain here? And he told me multiple times it was because of the way I was picking up my daughter. And of course, I didn't really listen to him, and over the first couple of months, it got progressively worse. And I found out later that a lot of my patients, their mothers have this exact same pain, and a lot of our friends who are new moms have the same pain. So we wanted to talk a little bit about it today.
Thank you.
This is Olivia's doll.
So every time you pick up that child with the thumbs around the armpits and you're grabbing the child and going up in that repetitive motion, it leads to strain right here near the wrist on the thumb side. And the tendons in that area have increased friction because the sheath overlying those tendons are thickened, and as a result it becomes super painful when you grip things, when you pick up your child, when you're texting, and all those things can actually become so painful that it actually drives moms nuts. But this doesn't only happen to moms. It happens to nannies, it happens to new grandmothers, people who are texting a lot. And so it's really important to calm down that area. And the first thing you can really do to treat it is activity modification. Stop picking up the baby the way you normally pick it up. So what I used to always tell my wife is, instead of grabbing the baby from the crib with the two thumbs around the armpit like that and pulling up, instead put one hand underneath the head and one hand underneath the baby's back or buttocks, and then pick up the baby to your chest. And that avoids that motion. So that's the first thing. And picking babies up in that manner in the first place would be a preventative move, I think. Secondly, you can ice the area and take anti-inflammatories. Now, we have a whole video on whether or not you should take anti-inflammatories while you're breastfeeding, but it is safe. Some people will go as far as wearing a splint that calms the area, so they have decreased motion in this direction, so the tendon excursion or movement decreases. Now, if none of those things work, the other options are to call a doctor and go see an orthopedic surgeon or a hand surgeon, a hand specialist, and possibly have a steroid injection. That improves about 50% of people's symptoms. And if none of that works, there's always a small surgery where they release that sheath that's thickened so the tendon can travel without causing pain. So those are basically the ways to prevent and treat mommy thumb, which is also known as de Quervain's tenosynovitis.
So in closing, the best thing to do is to just prevent mommy thumb from the beginning, which would just be to pick up your baby with one hand under the head and the other hand firmly under the back or the buttocks. But if you do end up getting mommy thumb, the best advice would be to take the anti-inflammatories, to do some ice locally over the area, and then if it's getting a lot worse, you could always go and see your doctor, possibly for a splint or maybe even for an injection in that area, and worst case scenario, some surgery. Yeah,
you can get a splint over the counter. It's called a thumb spica splint or the injection, and then very last resort is always surgery. You nailed it.